As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, US versus China, where I'll take you behind the scenes in the tumultuous US-China relationship. Find Face Off wherever you get your podcasts.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by Dr. Erin Faherty, who's a pediatric cardiologist who treats kids at Yale New Haven Children's Hospital. She also went to med school with my husband, Ethan, so this is a very special episode for me. So today we're going to talk about myocarditis, specifically addressing some concerns around COVID-19 vaccines. The clock is ticking, so let's get to it. All right, Erin, so just to kick things off, can you remind us what is myocarditis and what are some of the typical symptoms that parents should look out for?
Sure. So myocarditis is essentially inflammation of the heart muscle. Myocarditis can occur in children and adults, and there's a range of severity of myocarditis. Most cases are mild, but you can have a case of severe myocarditis as well. And most commonly, myocarditis is caused by viruses, but you can also have inflammation of the heart or myocarditis from autoimmune diseases, medications, toxins, and then rarely vaccines. And that includes a smallpox vaccine, which is one of the most successful vaccines in the history of vaccines, as well as COVID-19 vaccine. Some of the typical symptoms of myocarditis, oftentimes a patient complains of chest pain or chest discomfort, sometimes a sensation of palpitations or a racing heart or feeling an irregular rhythm. Sometimes it can be associated with shortness of breath, feeling unwell, fatigue, sometimes a fever.
All right. So, Erin, we've heard about a possible link between COVID-19 vaccination and myocarditis in children, especially for teenage boys. Can you talk a little bit about any potential connection between the two?
Myocarditis after COVID-19 vaccine is rare. As you mentioned, this risk seems to be highest in young men between the ages of 18 and 30, with the highest risk after the second dose of vaccine. And we think this is some overreaction, if you will, of the immune system, and why one person may have that reaction after the vaccine compared to another, we don't quite understand yet.
Got it. All right. So compared to the risk of myocarditis from COVID infection, how does the risk associated with vaccines stack up?
So while the risk of myocarditis has been highest, as we mentioned, in young adolescent males and young male adults, the study suggests that the severity and the outcome of myocarditis after COVID-19 infection is worse. And when we think about the risk of COVID-19 vaccine myocarditis in children compared to the risk of COVID-19 myocarditis, we also need to think about the other sequelae or risks of COVID-19 infection. And that includes, respiratory illness from COVID-19 infection. That includes MIS-C, which is multi-system inflammatory syndrome seen in children, which is rare, but is life-threatening. And there have been deaths in the United States of children from MIS-C, as well as the long COVID sequelae.
So what I'm hearing, and what I've also seen in the literature, is that myocarditis, it is a possibility, but myocarditis after COVID vaccination tends to be, you're at lower risk of it versus after infection. And also, if you do get it, it tends to be less severe after vaccination than after illness. Is that right?
Correct. From, essentially, as you mentioned, from the data we have, the risks of COVID-19 infection far outweigh the small cardiac risk of vaccination.
So what advice would you give to parents who are hesitant to vaccinate their child due to concerns about myocarditis?
Yeah, I think it's hard as parents. We're all just trying to do what's right for our kids, and these decisions are difficult. I'll add, as a parent myself, I couldn't wait to get my 2 children vaccinated because as a pediatric cardiologist, I've seen children who are very sick from some of the conditions we mentioned before, with Miss C in the hospital in the ICU, with respiratory illness from COVID-19. And I've seen several children who are suffering from long COVID. And so I think, again, at the end of the day, we're trying to do what we think is best. But I truly do think that the risk of COVID-19 vaccine is much less than the possible risk of COVID-19 infection and its sequelae.
And Erin, please correct me if I'm wrong, but my understanding is that the majority of people who do develop myocarditis after vaccination, the cases are typically mild and most resolve with rest. Is that right?
That's correct. Fortunately, most cases of COVID-19 myocarditis are mild. So these patients often are in the hospital. If they even are hospitalized for a couple of days, they essentially need some rest and supportive care, often even just an anti-inflammatory like Motrin is what all they need. And that they do overall really well.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Please leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you like this podcast, can we recommend another one? It's called Big Picture Science. You can hear it wherever you get your podcasts, and its name tells part of the story. The big picture questions and the most interesting research in science.
Seth and I are the hosts. Seth is a scientist. I am Molly, and I'm a science journalist. And we talk to people smarter than us, and we have fun along the way. The show is called Big Picture Science, and as Seth said, you can hear it wherever you get your podcasts.